Now, today we're shining a light on a critical issue that has been quietly claiming lives in our communities. South Africa is set to make history by launching Africa's first comprehensive national action plan to combat the scourge of fake and substandard medicines. Well, joining us to discuss this, we've got the South African Health Products Regulatory Authority CEO, Dr Boitumelo Semete-Makokotlela, who will share insights into the groundbreaking initiative and what it actually means for our healthcare system. Doctor, it's a pleasure to have you, and thank you so much for your time.
Thank you for having me on the show, Leanne.
So you've highlighted the three-pillar strategy, that's prevention, detection and response. How is this going to be implemented on the ground? And perhaps maybe let's have a look at some of the timelines for seeing measurable and quantifiable results.
Thank you. So this is a strategy that involves a range of stakeholders, including the National Department of Health, the police services, and the Pharmacy Council, just to name a few, including the Border Management Agency. So critical to us is that we've already done this pilot. We've put together the steering committee that has put in place how we're going to cooperate as national institutions. We then, as part of our mandate as a regulator, we have to ensure that any reports to us of any substandard and falsified products, we address that and we ensure that the law is followed. And this is where the police service comes on board. So we've already done some things around this. And as we launch an action plan that we've tried and we've tested, and we've got great support also from the WHO.
Yeah. What about, I suppose, hard evidence and statistics on how many lives have actually been lost or affected due to these substandard medicines we're talking about?
That's something we don't have, and that's why this national action plan becomes important, because for us to prevent and to adequately respond, we must have these statistics. So we know that around the continent there's been deaths, primarily of children. You may have seen reports last year in the Gambia where children died from consuming a substandard cough syrup. We haven't seen these in South Africa, but it doesn't mean they're not there. And so hence we urge the public to report this to us. And that's why, again, we're working with the Pharmacy Council, because then it engages with the pharmacist at the different pharmacies to say, if there's anything that you detect, please notify us as a regulator.
Yeah.
But in terms of numbers, the numbers we have is that there's an increase in the reports we're getting. If I can make an example, in 2021, we would get on our whistleblowing platform about 130 or so reports. Just this year, we've received close to 500 reports. So it shows that the public is aware, but it shows that this issue is certainly becoming a great concern.
It is, and I mean, it is. I'm glad we're getting, to grips with this and actually understanding that this is a major problem. But you mentioned cough syrup, but just as a matter of interest, what medicines are most commonly falsified in South Africa? What should we be on the lookout for?
Yeah, so a lot of the over-the-counter medicines. So if you look at a medicine that many of us take, Grandpa, we're finding that it is either falsified and, other cough syrups, like the ones that contain codeine. And what we're seeing is that, and this is how the public can take note, that if you see that the labeling is not what you used to seeing when you would get that medicine over the counter, the coloring of the package is different, the wording there is not legible, then you know that it could be falsified.
Yeah.
And from substandard, if you look at a cough syrup, the minute it has granulates, then you must report to us. If you're using, for example, an effervescent tablet, if it doesn't fizz, or if it's a tablet that breaks the minute you touch it. So it's really around the quality also. So if the public sees anything that seems untoward, if they could report it to us.
It's absolutely frightening, because, I mean, when you take these things, I suppose you don't really, it says Grandpa on the packet, so you just assume it's fine. Meantime, it's poisonous, and people are, we become very, very sort of complacent, and you don't think that anything could possibly be untoward, and yet it is. So, you've given one example, and I imagine through time you will be announcing more. But I just want to find out from you what measures are actually in place to ensure that townships and rural areas are reached and protected, where regulation is often at its weakest, and how can patients or community members alert authorities about the suspected fake medication that you're speaking about?
Yeah, no, excellent question. So, what we urge the public is please get your medicine from a licensed pharmacy. If you do get medication from anywhere that is not licensed, it does compromise you as an individual. So that's one of the critical elements. The second is if you pick up anything that does seem untoward you, the medication doesn't look like it's of quality, or after taking it, you feel unwell. We've got a whistleblowing platform on our website. There's even a number that you can call. Please do call us on that number. Do report it to us or even to the pharmacy council, or go to your nearest pharmacy. I mean, in many of our townships, we do have licensed pharmacies. And so I would urge them that please go to your nearest pharmacy, report this, and that pharmacist will tell us. But we have to be notified so that we can act.
Yeah.
What we've been able to do in some instances is block these at the ports of entry. Hence, the collaboration with the border management agencies is so critical, because we don't want them to be in the country.
Yeah, and that's where you find problems happening as well. And I know you say go to a reputable pharmacy or one that you trust. But when you're talking about these kind of things, I mean, I'll just give Panado as an example, or Grandpa, as you suggested. You can go to tuck shops, you can go to cafes and wherever else and actually buy that. So that's something that we need to be very, very aware of, is that these over-the-counter medicines can be bought freely from many places. So you've got to be very, very alert.
No, absolutely. Because I mean, if you go to a spaza shop, I'm from Soweto in Diploof. If I go to a spaza shop down the road, I will find, Grandpa. And it is over the counter. But the critical thing is that the public must know that if they feel dissatisfied with the product, they must report it. They must report it to us.
Yeah, absolutely. Thank you so much. I know it was such a short amount of time, but I think we've really sort of given people some food for thought, because really just take care. If things look different, the packaging is not right, if it doesn't look like this is what you're used to taking, please don't do it. Just do not do it. Be very, very careful, because there are a lot of these fake medications that are dangerous for you that are in the market. And this is what we're seeing, that the South African health professionals are going out, and they are making sure, the regulatory authority are going out with this initiative to try and combat all of this. And that was, of course, the CEO of Sahpr, Dr Boitumelo Semete-Makokotlela, talking to us about this initiative.